pain like across my lower back. I'm probably a bit wonky. It was like clicking here.
And hold. No. Okay, that's all right. So I'm going to have a little feel of this sacroiliac, see if there's some soreness there.
Yeah.
Can you put your little finger to your thumb? I'm going to try and pull them apart. You're going to hold together and hold. Fantastic. And thenar muscles of the hands deeply. I'm moving to see if the ankle comes with me. To open up the back and open up the front. That feels so good. And then a beautiful neck release. Letting go, tilting back, beautiful, lovely, all the way back. So much better. Okay, Khamsin, what's been going on?
I spent 2 days at Peppa Pig World with the kids.
Nice.
And had to carry Ezra a lot.
Okay.
And he's obviously now like 15, 16 kilos. So, yeah, not great. So I'm getting a lot of pain like across my lower back.
Yeah.
And then like down the outside of my left leg and the inside of my right leg.
Yeah.
Which is making me think I'm probably a bit wonky.
Yeah.
And then I was walking around the house earlier and every time I stepped my back, it was like clicking here.
Yeah.
I thought this is really not good.
Okay.
And then just the usual like achy, like middle of my shoulder, in between my shoulder blades, which I usually get anyway. But,
yeah. Yeah. Okay.
But yeah, I think there's something going on in my pelvis.
Yeah, because it was in pregnancy, wasn't it?
Yeah.
And then we sorted it out. It was your right pelvis,
yes,
right side of the pelvis then. Okay. How's your neck?
It doesn't feel too bad, but that doesn't mean it's good.
No, okay, but at least it's not giving you symptoms.
Yeah.
Any headaches?
Yes, quite a lot. But then I am having, so I've finished my treatment for the low folate, which obviously gives you headaches, but they never like 100% got better. So I've actually got to have some more blood tests for that.
To see if there's something
else.
else.
To see if the folic acid actually worked.
Right.
Or if there's something else going on.
Yeah.
So it's sort of got to like sort of 50% better and then
Okay. And how's sleep?
didn't.
Obviously you've got 3 young children. So.
It's okay, but I have like more in the last couple of weeks started waking up at like 4 in the morning and not being able to go back to sleep.
Oh.
Which is quite unlike me.
And that's not because of the children being away?
No, they're actually doing a really good job of sleeping in the moment.
Nice. Well, at least
obviously
there's that,
I'm
but
not.
That's not great for you, so you're not getting enough sleep?
Probably not, no.
No. All right. Let's hope you sleep well tonight after this.
Fingers crossed.
Okay, would you like to lie down on your back?
Okay.
It's all heated, is that okay?
Yes.
Or are you feeling hot?
No, lovely.
Okay, lovely. So can you raise an arm for me, Khamsin? I'm going to push here, you're going to hold up and hold. Okay. And hold. And raise a leg and hold. And hold. Okay, let's raise 2 together and hold. Yeah. And hold. No. Okay, that's all right. So I'm going to have a little feel of this sacroiliac, see if there's some soreness there.
Yeah.
Okay. Is that where you've been getting the pain or not? No, higher up here.
More like across my right at the lower back, like across my coccyx and that sort of area.
Coccyx? You mean right at the very, very bottom? Okay, because I'm on the side of the sacrum here. I thought you meant higher up, like the top of the sacrum.
No, like way, like right down.
Interesting. Okay. Right, now I've therapy localised that. Let's see what this is and hold. I think you've brought some craft in with you.
Oh, it's probably Ivy's. Part of Ivy's Halloween costume, I imagine.
Okay. I thought it was your sock disintegrating. No. It's cute.
No, Ivy was wearing an Elsa dress with a light up skirt for Halloween yesterday.
Of course she was.
It was all over the floor by the time we got back.
Very sparkly.
Oh, it was very, very sparkly, yeah.
Oh. Right, okay, so Can I just do that again? Because we were talking and I noticed the sparkle and it completely put me off. So, do you mind if I go a bit lower then?
Go ahead.
Yeah. Okay, so arm and leg and hold. Hey, okay, so that's what we want. Let's just make a mark of that. So that was right side. Oh, yeah, it's good that the left is holding, because if it was bilateral, we'd be doing that one.
Okay.
Right, let's move on. Arm and leg opposites and hold. Not great. And the other sides and hold. That's all right. Could be that hip again then.
Okay.
Okay, let's see. Give me an arm and hold. Yeah, it's fine. And hold. Yeah. And hold. Lovely. And hold. No. Yeah, okay. And hold. So you've done a good job of self-diagnosis. And hold. Don't know about the ankle as well, actually. Let me just have a little check of that. And hold. Yeah, it doesn't like it doing that. And hold. No, it is not great, is it? And hold. Yeah, there's a lot of bounce going on. And hold. Have you done anything to your ankle? You've been over on it, or? Do you know people tend to stand on one leg? Do you tend to stand on that leg?
Yes, I
You know,
think so.
especially
Yeah.
holding a babe.
I always have them on my right side when I'm holding them.
So you stand on the leg
Yeah.
of, that you're holding
Yeah.
the side of. That's
Yeah.
what you do, don't you? Yeah, and then that's your operating side.
Yeah.
But you're not left-handed.
No.
Because normally...
Normally you hold them in your left and do what you need to do with your right. Yeah.
So that's your operating. I'm
Yeah,
good
I
with
do it the other
keys
way.
and making cups of tea and things.
Yeah, no, everyone,
Okay.
my mum and my
So if
sisters
you
always
needed
tell me
to
I do it
write
wrong.
something, you'd have to switch him over.
Yes. But how often do you have to write something?
Oh, these days. Well, okay,
Never.
which is your texting hand then?
I can ambidextrous.
Multi-text.
Yeah.
Okay, right, okay. Showing off now. So that was your right hip and ankle all. Right, let's have a look at the hips then, see what they're doing. Your higher here as well. Higher here. Higher here. So I'm wondering if this one is dropped, but your body will tell me. Okay, now let's use this arm and hold. Okay, can I just check this arm on its own and hold? No, that's a good hold. So we're going to compare it to that hold and hold. No, okay. So actually the left hip isn't happy either. And hold. Okay. And hold. Not too bad. And hold. Yeah, okay. So yeah, dropped. Yeah, like I thought, dropped this side, left side. Let's just see if you're intact and hold. That's not too bad, but I just want to double check it. So can you put 2 fingers on your pubis symphysis bone? Yeah, and hold. I'm happy with that, that's fine, good. Okay, so, okay, the pubis symphysis was good. Okay, let's do a ballet. I'll check your piriformis and quads as well. So can you put one sole towards the opposite knee, resting this knee out as comfortably as it can, and then just give me this arm and hold. That's all right. And the other way around. And hold. Not so much. So what we're testing there, you can put the leg back down, is whether the hip is happy opening or not. You're actually happy with the left hip opening, but not the right. Does that concur with how you are in life? I mean, you know, some people sit on the sofa with one knee out, one down.
Yeah, I
or
usually
in
sit-
bed, do you have one knee out, you know, or...
I sleep on my side. And yeah, if I sit on the sofa, I tend to sit towards my left.
Okay, with both knees up.
Yeah.
Okay. Okay. Yeah, in which case this
The left
knee
hip,
would be
yeah.
coming this way, which it's happy with, and that one isn't if it's going that way, yeah, on its own. Okay. Ballet. Right. Right, let's have a look at the pubis symphysis, the piriformis. So bending the knee and letting the foot come over here. I'm going to try and bring the foot back to me. You're going to keep it crossed over the other leg and hold. Yeah, you're really strong with that. It's really good. Same again. I'm going to try and push back. You're going to keep it crossed and hold. Really strong, really good. Oh, but it hurt you. Did that just click?
Yeah.
It was like a clunk.
Yeah.
And you pressed at the front.
It's like here. It clunks in here.
On the iliac. Okay. So not at the back on that place you were saying.
No, it's there. It's sort of in here.
We'll sort that out. Okay. Okay. So the piriformis muscle is deep inside the pelvis, as well as the psoas from the waist that I'll check now. But you've passed the piriformis, so I'm really pleased about that because that all makes part of the pelvic structure. So we're going to take this leg out all the way to me and up into the air. I'm going to try and push down to the floor. You're going to hold up and hold. Yay, lovely. Right, I'm going to lean across you and hold. Yay, brilliant. That's a really good sign for your neck.
Good.
Bizarrely. Okay, so we're going to bend the knee again. We're going to test the quad. So we're testing this big strong muscle here, which should be absolutely strong like steel.
Yeah.
So therefore I'm going to be putting quite a lot of pressure against it. I'm going to go this way. You're going to keep it at right angles here and hold. Lovely. And hold. Wonderful. Didn't budge a millimetre. That was great. So that is really good for your upper leg strength, and of course these muscles all connect to your pelvis as well, so that's why I'm testing them all. Ankle, must remember. How's abdomen and tummy in?
Yeah, pretty normal.
Can I just have a little?
Yeah, of course.
Yeah. So normal means good?
Yes,
Okay.
yeah.
Gosh,
Sorry,
these
I've
are
got layers and
high-waisted,
layers
aren't
and
they?
layers of clothes on.
Yeah, it has gone cold outside. Okay, let me just feel this. How's that feeling?
Quite sore.
Have you just eaten?
No.
Okay, give me 2 fingers where mine are, into there. And then just this arm, I'm going to push, you're going to hold up and hold. Okay, that is quite shaky. So that definitely might need a bit more, but you know, well, actually, I've seen it a few times recently where the gut is actually causing the pelvic misalignment.
Okay.
And actually, because this is on the right hand side and you've come in talking about the right hand side pelvis, then it might well be connected. So I'm just going to test another few things with the abdomen.
Okay.
If everything else is passing, then I will just simply do something localised to this area here, the iliosacral valve. But if it's all saying help, then I might need to do something here.
Okay.
Okay. So nice flat hand. Okay, there. Give me your arm and hold. See, that's okay. So that was your liver. That's good. So ends of fingers like that, flat ends here, and hold. Tiny bit shaky, and then pointed fingers in there and hold. Hey, that was strong. I'm pleased about that. Into there and hold. Good. Okay. So now your finger under your rib like that. This rib. Yeah.
Yeah.
And hold. Good. Yeah. And then 2 pointed fingers into there. About there. Yeah. And hold. Oh. Oh, no strength there. And then 2 pointed fingers again here and hold. Okay. You can release your hand and arm. You can put your arm down and hold. That's all right. And again, and hold. Okay, that's all right. Okay, so it was actually just the lower abdomen, i.e. close to the pelvis. So the three areas are your iliosacral valve on your right hand side, your Houston valve on your left hand side, and a meridian point, which is quite important for our overall health, which is called REN.
Okay.
So I am going to do some localized sorting out. So can you give me 3 nice long breaths? So I'm just opening the ICV so that the valve, the valve flaps if you like, are not blocked or congested, and they're able to open in the right direction. They're not twisted or impinged in any way. We will test it again, but I'm just going to come around and do exactly the same again to the Houston valve. So 3 nice long breaths. Yeah, well done. I know, but it needs to happen.
Yeah.
When I have that done to me, how it feels to me is if there's a little gremlin that's sitting in there like a little green man, and he's going, "No, you're not supposed to be doing that. Get away!" And it feels like it's punching back, because it just feels like what I'm doing to you isn't meant to happen. It's like, I'm sure this is wrong, but actually it's what needs to happen. So both of these valves have flaps, just like in your circulatory system, allowing free movement of, in this case, food, chyme, which is going through in one direction and at a correct speed and flow that allows nutrients to still be absorbed in your small intestine, i.e. not too fast that the nutrients aren't being assimilated correctly, but also that it won't get blocked, because what can happen is it can be impinged by something on the outside of the tube. It can be twisted, so torsion of the valve, which can obviously block it. It can be blocked open, or it can be blocked shut by food, normally, depending on what we eat and whether we're chewing correctly, etc. So by massaging it and opening it in that correct manner, whatever the problem is, whether it's impinged, twisted, blocked open or closed, it will deal with it, it will sort it out, whatever the problem is. Same with the Houston valve. So Ren, I am just going to give your Ren a little bit of Gong. Just going to put my hand on that beautiful, it's called the conception vessel. I'm just going to give it a little bit of healing, just for a minute. So feeling the warmth coming in, it feels really good, really positive energy, very warming and full of vitality. Okay, so let's have a retest. So 2 fingers here into your ICV and hold. Wonderful, entirely different. You didn't even have to try. 2 fingers on your Houston valve and hold. So different, no shake or hesitation. 2 fingers again, just on your Ren and hold. Lovely. So it's what you needed, and I'm hoping that will also help your hip, but I will also treat your hip. Okay, you can turn over. I'll just get some tissue. Okay, so while I've got you here on your front, I'm just going to do another test actually. Can you put your little finger to your thumb? I'm going to try and pull them apart, you're going to hold together and hold. Fantastic. Just going to keep coming back to that and hold. Okay, so can't support that one, and again, and hold. Yeah. And hold. Good, okay. And hold. Okay. Okay, so south and east and west of your sacrum, not great. North is just about okay, but we will sort that out. So I'm going to start in the middle of the back so that by swaying the spine side to side, it will start having a warming, moving effect on the lower sacrum, and the spine, also the neck. Feels quite tight here, like you said, between the scapula, and then a little feel around the sacrum. This was the area at the start which was a little weak, with a sacroiliac separation on the right hand side. Bringing in some movement, fluidity, some softness. Okay, so the muscles are nice and warm now on that side. Just now working on the actual spine along the line. It's really tight here in between the scapula and further up, higher thoracics. Got some nice movement here in the upper lumbar. So I am using the Tuina techniques quite low down all around the sacrum, tracing that line, using the thumb and thenar muscles of the hands deeply to encourage warmth, circulation and fluidity in the whole pelvic girdle, and then around that iliac, the iliac crest at the front. The waist. Kidneys, other side. Again, repeating the moves, using the heel of the hand around the sacral edge, all the way to the coccyx. And on the sacrum itself. I'm thinking I might need to bring in a couple of cups, especially for this area, funnily enough. Is that okay, Khamsin? Yeah. Okay, let's see if I can bring some softness into that upper back by using a wing stretch technique. Relaxing the shoulder. Letting it go. I know. A bit better. Yeah. And relax. Pulling that wing out as it rotates. Hooking the fingers underneath the edge. Still quite a lot of tightness there. Bouncing the shoulder down. This helps the neck as well, of course. Then hooking the fingers underneath the scapula and with the heel of the hand while pushing the fascia up. And relaxing the shoulder. Of course, when we're being manipulated like this, we tend to hold on a little tightly, just in fear of pain, protecting the shoulder. Lovely, hips are moving nicely. And swinging the pelvis side to side with a beautiful spinal walk past the kidneys, sitting on the sacrum, sacral edges, always reading the body at the same time, seeing what it's telling me, seeing if it's soft and warm or not. Okay. So just applying some warmed oil. Warming up the cup, testing it on my arm. First one is going here. So I'm also reading the cup colours, and having already performed quite a good amount of Tuina massage on the back, there should be a good rosy colour in a good amount all the way down the back, whereas when I'm doing the cupping I can tell that the upper back is nice and rosy. Whereas when I come down to the lower thoracics here and lumbar to the edge of the sacrum, it's quite pale, showing more likelihood of pain and dysfunction. Obviously there was quite a lot of tightness in between the scapula and pain, symptomatic pain here. That should be a lot easier after those techniques, but the cupping will also help that. So what we want to achieve now is some of that lovely rosy colour that has come through with the cupping and the wing stretch and the Tuina on the upper back. We want that to come down to the kidney area where I'm working now. We have two kidneys and they sit each side of the spine, just above the waist. In fact, the right hand kidney is slightly lower than the left, so the right will be about here and left will be about here, because the right hand one is pushed down slightly because of the very large liver that sits just above it. Is that sore on the sacrum?
It is a bit, yeah.
I thought I could feel that. Is it too much, Khamsin?
No, not at the moment.
No. Do tell me though.
Okay.
Okay. So I might just leave one there. It's quite pale. That's how I could tell it was sore, because there isn't much blood getting through. So I'll leave one there to do its work. Introducing a second cup. Warming the edge. Massaging round. It's a nice big cup, so it gives a nice whole back treatment. Back's going lovely and rosy now. It's a really good colour. That bodes well. And then shifting that tight spine that was left and right, getting it moving just like a rocking technique. And then the very base of the neck to the T1 that can get quite rounded with like a text neck. Okay, so when the flame starts, it tends to be stronger and therefore more vacuum and a stronger, tighter cup. So I tend to move a little bit more slowly. And definitely around the bra lines, because these can impinge the spine and the lymph nodes and circulation. So it's really good to get a cup along that bra line, sometimes over the top of the bra lines too, over the shoulders. Good, kidneys are nice and rosy now, so just going to concentrate a little bit more on the sacrum. And because of the pain there, not wanting to introduce too much movement, just going to let a couple of cups sit there. Warming a third cup. Introducing to the very top of the sacrum. So when we tested the sacrum earlier with northeast, southwest sacral tests, notice that north was okay, but the other three were not great. How are we doing?
I'm okay at the moment.
So the way I see it with cupping is it's almost like I'm colouring in the body. Anywhere that is pale and uncoloured, not rosy, needs that beautiful blood circulation for some good chi, some good blood movement. And where there's blood, there will be energy and life and health. Introducing a fourth cup, using the nice big cups today. Okay, good. Okay, so concentrating on the pelvis, upper sacrum. Might just bring them down a little bit. Because the area of pain was quite low. Okay, how are they feeling?
A bit more sore.
Yeah, bearable?
Yeah, it is. It's okay.
Yeah?
Yeah.
So long as they don't move?
Yeah.
Yeah, okay. But I can tell it's bringing toxins out because there's a fair amount of fluids coming out of the body. So that's a really good sign, because if someone's coming in with issues and pain, then I want to make sure that there are signs of getting better, and this is one of them, because we're getting rid of waste, getting rid of toxins. So that's good, actually a good sign. So we've got a nice rosy upper back from about bra line upwards. And it's almost like the bra line is marking the difference, and then below there is a lot of red rosiness now, which is great, but it's not uniform, it's not all over the waist and hips, but I'm going to leave those on for a little while, do a couple of other techniques and come back to them. Okay, so relax your foot. This was the ankle that came up earlier, so I'm going to give it a little bit of Qigong while I'm here working on the foot. So first of all, releasing the standing point. So the big toe and the neck of the big toe are so important to our overall body structure. So by releasing any tightness on the neck of the big toe and the ball, that helps us to walk, stand, run, etc. so much better. So I'm just holding the big toe ball and then softening, rotating, trying to separate the ball from the rest of the foot. And that's the equivalent of separating our scapula from our back, being able to pull it out and round. Bringing in some softness, fluidity. And down this spine, so the inside line here of the foot is the equivalent of our spine in reflexology terms. So again, a little bit of Tuina between the fingers, rocking, moving, and always assessing and reading the body. That feels better. Then I'm just holding into the ankle, seeing what it's telling me, rotating a little, seeing if there's any clicks. And then anchoring into the pelvis, tilting out, and leg repatterning, using the leg as a lever to work on the pelvis. Seeing those cups move, relaxing the leg back down. I'm just going to work on that ankle again with some Qigong for a moment. I'm moving to see if the ankle comes with me. Some beautiful fluidity and yoga, if you will, to the joint. That feels good. Lovely. And then relaxing the other side. Again, repeating with the neck of the toe, using 2 strong thumbs to massage up the back of the neck, the sides, and into the spine, cervical spine. Or, yeah, quite tight on the spine to the side of the scapula, just like it was on the back. And then working down the spine all the way to the coccyx. A bit crunchy on the sacrum. That's where it clicked earlier. And then into the instep, feeling at the kidney, to the ureter, to the bladder, encouraging release of toxins down and out. And then separating the ball of that foot, holding it firmly but not hurting, in a nice, soft, supportive gesture, circling the whole joint of that big toe and the ball, moving it one direction and the other, trying to separate from the rest of the body. And down the thyroid here. That feels quite congested there, so it really is good for the thyroid to open up the back and open up the front. So it needs flexibility forwards and back, the thyroid being held right at the front here. That's good. Supporting the foot, giving it a little turn. Anchoring into the hips. Tilting the foot out to raise the opposite hip. And then leg repatterning, helping the opposite pelvis realign to where it should be. Resting down. And then anchoring into both for a beautiful sacral fixation. Relaxing the legs, I've got you, that's it. Nice floppy dong, beautiful. So I'm looking at the pelvis the whole time, realigning so it's nice and level. Especially after those tests we did earlier that it was a little twisted. So just looking at the cups once more, giving them a bit of a movement before they come off. That's probably quite sore, isn't it? Mm-hmm. Mm-hmm. Well done. Well done. Putting a cup back on the sacrum. You okay?
Mm-hmm.
So I've got them on the kidneys and one on the middle top of the sacrum. Then just going to do a little qigong for the rest of the sacrum around that cup for all the areas that were out of alignment when we tested them earlier. Well done, Khamsin, you're a trooper. Mm-hmm. So just clearing up the remnants of the oil. And any fluid release. And cut marks are quite pale today, actually.
Okay.
And relaxing your arm. That's it. Okay, let it go, let it go. This is actually working on that area between your scapula and also on your neck. just got my fingers on the inside edge of the scapula, bringing it out, softening the fascia in between the spine and scapula. Okay. Oh, it feels easier this time, this side. Interesting. This is the side you hold babe. Right, want to feel those hips. Looks more level. Yep. Oh, okay. Looks more level. I think the repatterning might have helped. And cupping. Okay, Qigong. That feels so good. Okay, bringing my hands down as far as they'll go, all the way to the bra line. And then shifting spine. Ooh, that's tight there. Left to right. Which means it wags the head, which is a good thing. It's reacting. Okay. Yeah, so it's quite tight. Left hand side about T6. So quite high up between the scapula. This must be the place that was causing a little pain. So relaxing, relaxing, relaxing. Breathe, let the muscles go. Let them accept and respond to the realignment, softening. Definitely more tight on your left. And then a beautiful neck release. Letting go, tilting back, beautiful, lovely, all the way back. And then let the weight go all the way down to the couch. Allowing that space where the fingers are touching in between the occiput and the top of the neck at the C1, bringing in some space, some softness. A little stretch, and then bouncing the spine down and pushing the spinal processes away. Same on the other side. Bouncing the spine down. And pushing the spinal processes away one at a time. tight here, about C4, right hand side. Holding, massaging. Lovely, letting go, letting go. Beautiful, tilting all the way back, just naturally. And stretching. And then bouncing the whole shoulder down, creating some length between the shoulder point and the neck. And a good stretch. Same to the right, bouncing. And at this point, the shoulders should bounce back. Some shoulders don't, but that's good, it's bouncing back. And a good stretch. And then finishing off with a little cranial balancing, working on the parietals and the temporals. Okay, taking a nice deep breath. And bringing the breath all the way down to fingers and toes, slowly stretching through every digit, maybe turning into ankles and wrists, and rotating shoulders one way and the other. Bringing your arms over your head if you feel like it, for a whole body stretch. You feeling okay?
Yeah.
So just going to retest a couple of things. So right ipsy, right ballet, right ankle. It's all on the right hand side, isn't it? So arm and leg and hold. Much better. There's a tiny bit of softness there. Can you feel it? It's not like steel, but it's a lot better than it was. So just going to feel that ankle. Give me this arm and hold. Brilliant. Okay, ankle's fine. Right ballet. So can you bend that knee, putting your sole towards the other knee, resting that knee out, and hold. Easy. Does that feel better than it did earlier? Yeah. Okay, so just right asis and a twist. Ooh, and hold. Yeah, no brainer. You don't even have to think about it. And then a dropped hip and hold. Easy. So let's have a look at you. So much better. Good. I think you're going to feel more level. You won't sort of feel out of balance. Yeah. Yeah. So you're okay to move when you're ready. See how your body feels when it gets up.
Feel much more flexible through my spine.
Flexible through your spine. Yeah, good. And hopefully that right hip won't feel, well, it won't clunk anymore. What were you doing that was making it clunk?
Walking.
Do you want to walk?
Yeah, it's not clicking now.
Yeah.
Earlier when I was walking across the kitchen, it was going every time I stepped. I was like, oh, this does not seem good.
No, no. Okay, all right. No, I think you're going to be okay.
Cool.